I must say that usually when I am invited to speak at a function, it is about law enforcement. 34 years, I would consider myself to be a subject matter expert by now. But when Anna asked me to participate in this evening's event, I really reflected on the crisis that we're facing when it comes to health care. It made me reflect on this highly debated and sensitive topic. Health care is a serious issue, and tonight we want to raise the awareness level as well as money so everyone can be more informed about our major predicament. And since this is a very challenging topic, I want to try to interject a little bit of humor before I get into the hard data about our health care crisis. I want to share with you a collection of some actual statements from real patients medical records that have been recorded by real physicians from major hospitals in South Florida and throughout. Now, this material might sound like something from Saturday Night Live, except it's not make-believe. This is real. And some of the statements that were extracted from some of the patient's medical records reads, "The patient has been depressed since she began seeing me in 1993. The patient's medical history has been remarkably insignificant, with only a 40-pound weight gain in the past 3 days. Discharge status, alive but without my permission. The patient has no previous history of suicides. Patient stated that she had been constipated for most of her life until 1989 when she got a divorce." I was wondering if that was my family, so. "The patient was to have a bowel resection. However, he took a job as a stockbroker instead. She has no rigors or shaking chills. Her husband states she was hot in bed last night. Patient has 2 teenage children, but no other abnormalities. The patient refused an autopsy. By the way, have you reviewed your medical files lately? When it comes to health care, we're in a more crisis in more ways than one. Now, if you've been to Anna's website, she has a message that reads, "I have a dream that one day health care will be accessible to all people, regardless of the ability to pay." Now, according to an ABC News report, a lack of universal health care is often cited as one of America's leading domestic concerns. Yet, states and the federal government have failed to enact long-lasting, viable solutions for reform. And the United States remains the only industrialized country that does not guarantee health coverage to all its citizens. I know we have all at one time or another listened to the presidential debates and the different candidates' views on the healthcare crisis. And here are a few statistics that we should all be very much aware of. First fact, 1/3 of adults, that's 31%, and more than half of all children, 54%, do not have a primary care physician. Fact, almost 47 million Americans were uninsured in 2005. Fact, federal spending for health care totaled more than $600 billion in 2005, or roughly 1/4 of the federal budget. Fact, of 23 industrialized countries, the United States had the highest infant mortality rates. U.S. rates were similar to those in Hungary. The U.S. rates were similar to those in Hungary. Fact, our country, the great USA, ranked among the bottom of industrialized countries on health life expectancy at age 60, meaning Americans spend more years living in poor health resulting from chronic illness or disability. The last fact, barely half, about 49% of adults receive recommended preventive care and screening tests according to guidelines for their gender and age. According to another study, Access Granted the Primary Care Payoff, released in August, The U.S. healthcare crisis has shifted from the realm of the poor and disenfranchised to the doorstep of middle-class America. We need to wake up, people. America needs to wake up. Despite the wealth of the American economy, we are sorely lacking an adequate health care system. This report also details research findings that approximately 56 million Americans cannot find adequate care despite many having medical insurance because care is not available where they live or is too costly. In addition, more than 60 million people in the United States are either uninsured or underinsured. And around 50% of Americans cannot find medical care or treatment vital for recovery or containment of illnesses. So now someone may ask, what is the solution? I would ask, where is our 315? And in police work, for those of you who are in Dade County, you're probably familiar with an officer requesting a 315. That's an emergency assist. Fortunately, community health centers like Anna's come to the rescue. They are the 315 to the community. By serving the uninsured, underinsured, or even those insured but without access to primary care providers, community health centers address many ills that riddle America's health care system. To fill the needs of Americans living in poverty and in communities without medical facilities, generally called the medically underserved, community health centers popped up about 40 years ago, and today there are 1,100 such centers throughout the United States, taking care of more than 16 million people. The federal funding for such centers is approximately $2 billion annually. Community health centers are customer-friendly, and without motives to be profitable, provide services other healthcare providers are not willing to provide. The National Association